the anatomy 101 by Dr. Charmian Chong.
All right, thank you very much, Dr. Siraj, for the kind introduction. So first of all, I think just to give a background to everybody about what the aorta. Thank you very much, Dr. Siraj, for the kind introduction. Just want to give everyone a brief introduction about what the aorta is and what it involves. So just some background information for us to understand what can go wrong with it. So the aorta is actually the main vessel that takes oxygen-rich blood from the heart and supplies it to the rest of the body, all the different organs. It is what we describe as a cane shape, okay, extending from the heart, going slightly up towards the head before curving back down. It passes through the chest as well as the abdominal cavities, and then after that it supplies your the legs and the arms as well. So from this big what we call a big pipe that supplies blood to the rest of the organs, from this big pipe there's what we call smaller branches that come off to supply each individual various parts of the body. So these are critical to actually supply oxygen, nutrients, in order for the different parts of the body to function normally. If we look at the layers of the aorta, it's a pipe with 3 different layers. The first layer is a very thin layer of what we call the intima. This is the part that is connected through which the blood passes. It contains endothelial cells and connective tissue. The middle layer is slightly stronger. It has a smooth muscle tissue, allows the artery, the aorta, to actually expand with each heartbeat. It contains elastin and collagen as well. The last layer is the adventitia. It is the layer that helps to anchor the aorta in place within the body itself. So if we look at the different parts of the aorta, there are four main parts. The first part is the ascending aorta. The second part is the aortic arch, the curvature of the what we call the cane shape. The third part is the descending thoracic aorta, which is the part of the aorta that passes through the thoracic cavity, the chest cavity. And the last part is the abdominal aorta, which passes through the abdomen. So by knowing these 4 major parts, we'll look at each part separately, or what are the specific organs that they supply. So the ascending aorta, we have a diagram here which shows the ascending and the arch of the aorta. So if we start at the bottom, the ascending aorta contains what we call the coronary arteries. There are 2 of them, the right and the left. These are the 2 important blood vessels that actually supply blood to the heart itself, allowing the heart to have oxygen and nutrients for it to pump and work normally. At the arch of the aorta, there are several components. So we have 3 main branches of the arch. The first branch is what we call the brachiocephalic trunk. This splits into 2 further branches. The first one is the right subclavian artery. It provides blood supply to the right side of your arm. The next branch is the right carotid artery. This actually provides blood supply to your brain, as well as the right side of your head and the neck. The second main branch is the left carotid artery. This supplies the brain, as well as the left side of the head and neck. And then subsequently, we have the left subclavian artery, which supplies the left arm, as well as the back of the brain. So as we can see that the ascending aorta and the arch of the aorta actually supplies very critical organs, mainly the heart, your upper limbs, as well as the brain. And any problems with this can actually result in problems with these respective organs. Then we go on to the abdominal aorta. So from the abdominal aorta, we can see that it supplies all the main organs in the tummy. So for example, we have the first branch is the celiac trunk. It supplies like your liver, the stomach, the spleen. You have arteries supplying the kidneys as well. And also you have arteries supplying the intestines as well, the small intestines, the large intestines. So if if the aorta is affected, then blood supply to these organs will be affected as well. Subsequently, the abdominal aorta actually continues on to supply blood to both of the lower limbs. And so if there's any issues with the aorta, it can affect the blood supply to the legs as well.